everyone. I'm Dr. Monu Singh, Senior IVF Consultant, Krista IVF, Noida. Today we are going to talk about HSG versus SSG. HSG is known as hysterosalpingography and it is used to evaluate your tubal status. Okay, whether the patency of the tube needs to be evaluated, HSG is considered as the investigation of choice. Now, what do we do in an HSG? We take a dye, we push it through the uterus, it travels to the fallopian tubes and then it spills into the peritoneal cavity. And an X-ray is used to visualize the movement of this dye. This entire procedure is called hysterosalpingography. It gives us a detailed status about your tubes. If there is any blockage, it tells us about the side and the site of the blockage. It also tells us or gives us an idea about peritubular adhesions if it is present. It is associated with some complications, like some patients may complain of pain. There is very few reports of granuloma formation because of the dye, or certain patients have complained of allergic reactions from the dye. In spite of these complications, HSG is considered as the investigation of choice to evaluate the tubal status owing to its very high negative predictive value. Now, coming to the other topic, the SSG, which is called sonosalpingography. In this procedure, we use normal saline. This normal saline is pushed through the uterus, then the normal saline travels to the tubes and from there it spills into the peritoneal cavity, very similar to HSG. But an ultrasound, a TVS ultrasound is used to see the flow of this saline from the uterus to the peritoneal cavity. This is associated with less pain to the patient, but the negative predictive value of this test is not very high. Also, a good amount of training and a very sound knowledge of ultrasound is required to perform this test, and there can always be some intra-observer variations between two different doctors while performing an SSG, because we all know that ultrasound is user dependent. Although it is not associated with any kind of allergic reactions or granuloma formation, and the pain associated with SSG is very less. So, although HSG is the investigation of choice to evaluate your tubal status, but you can undergo either of them, either HSG or SSG, owing to your preference and of course availability of the tests. If you have any more doubts regarding this topic, you can contact us on the number given below. Thank you.
वीडियो को लाइक, शेयर और चैनल को सब्सक्राइब कीजिए। हमारे फर्टिलिटी विशेषज्ञ से मुफ्त परामर्श के लिए नीचे दिए गए नंबर पर अभी कॉल कीजिए।